This is the curve. They get a vertical thrust straight up. They could fall, but when they fall in flexion on the ischial tuberosity, it tends to rotate the innominate back. This requires a vertical force straight up, through the femur, through the innominate, on the sacrum. With the upslip, everything is superior on the affected side. PSIS, ASIS, iliac crest. In prone, you look at the ischial tuberosity, 6 millimeters higher than the other side, about the width of your thumb. But in standing, the trochanters are level. Not a leg length problem. If it is, the trochanters will be unlevel. But if the trochanters are level, the iliac crests aren't. The PSIS and ASIS are also up on that side. You're thinking upslip. Put them prone, balance the pelvis, see if the ITs are unlevel. Check your standing flexion test. That should be positive. Your stork and your reverse stork could both be positive. It's just stuck. It may tilt a little one way or the other, but you may have stork positive, not reverse, reverse positive, not stork, or both. Generally, everything is just locked. But these are shears. Whenever you have a shear in the body, that sets the stage for hypermobility. You correct it, but if it comes back, I'll correct it one more time. If they come back a third time, I put them in a belt. If that doesn't work, they go for what's called prolotherapy. You have to find doctors who specialize in PROLO therapy, proliferative therapy, where dextrose, or something similar, is injected into the SI ligaments, and it causes proliferation. It stabilizes a hypermobile joint. Something you may want to look into. I mentioned it in one of the earlier lectures. Prolotherapy. First used on the SI, now it's used on the shoulder, it's used on the knee to stiffen up areas of hypermobility. So you manipulate it. If that doesn't work, stabilize it with the belt. If that doesn't work and they're chronic, find someone who's good at prolotherapy who does a lot of it. Let me show you the technique to treat this. Let's see. Jamie. A few different ways to correct this. I'll show you supine and prone on your back. Let's have you turn around. Yeah. Now you have to take out the hip. What I mean by that is when you do the leg pull or the leg thrust, you don't want to thrust the hip. You want to recruit the hip joint. You want to place the hip joint in the path of the chain. We do that by internally rotating it. We internally rotate the hip. Back down a little bit. This leg can be straight. We want to loose pack the SI. Slight AB and slight flexion. 20, 30 degrees. Not much, very little. Just line up your forces with the SI joint. Internally rotate the hip. Slight AB, duction, and flexion. You want to place your hands above the malleoli. If I'm below the malleoli, I'm going to thrust the ankle. People ask about the knee. If the knee is healthy, it's okay. Just drop them down to extension. That close packs the knee. And then I internally rotate, AB duct, and flex. Now if I do the thrust, I pull everything down. I need to have mobility on stability. So one of the things we do is we get an assistant to stabilize the contralateral side of the pelvis. So I want you here like this, right into your anterior thigh. So when I pull it down, this side doesn't move. I also like to add a cough, because the cough is a momentary valsalva. Just gives me a little distraction on the SI joints. Momentary just separation there and mobilize it. So on the count of 3, we're going to time it. You okay?
Yep.
I'm going to ask you for a cough, and as I have her cough, I'm going to thrust. Now, as with any thrust, I need to take up all the slack. So I'm going to pull her down, take all the slack out, and then I'm going to do a quick thrust through the lower limb as she coughs. 1, 2, 3. I didn't time it right?
That was awesome.
On 3, take up the slack, lean back. 1, 2, 3. There you go. Now with thrust, I don't want to lose. If I imagine I'm using 10 pounds of force, I don't, before the thrust, drop down to 0. I want to maintain the 10. If I'm at 20, I want to maintain the 20. So it looks like I'm losing it, but I'm not. I'm just bending my elbows, but I'm still maintaining the force through my shoulder girdle. And I hit her at 20 or at 10. Don't lose that. That would be a long amplitude. It's high velocity, high velocity, low amplitude. So it's just a quick, like that. I'm at the barrier, and I'm thrusting it quickly, taking up all the slack, and then hitting it with just a quick thrust, short amplitude. Now that's supine. Turn over, please. This is actually quite nice because we're actually stabilizing the sacrum directly. So, Meredith, can you come up? So I'm going to have my assistant stabilize at the inferior lateral angle of the sacrum. So put your hand right on the bottom of the sacrum so that I pull the innominate, but the sacrum doesn't move. I internally rotate, abduct and flex a little bit. You got maybe come over here. Yeah, other hand going underneath so the sacrum doesn't come down. Good. Internally rotate, abduct and flex slightly. Pull back. You okay?
Yeah.
On the count of 3. 1, 2, 3. Yep. All right. So a couple ways to do that. Thanks. Thanks, Jane.
The internal rotation, you said that's creating close pack?
At the hip.
Okay.
Open pack the SI, close pack the hip.
Okay.
If I don't do that, the thrust is going to occur at the hip joint. So I want to lock the hip up with ligamentous tension and close pack the hip so that my force brings the innominate down. How far? Neutral.
So then whenever we do a traction for leg length discrepancy, we'll always talk to externally rotate because you want the motion coming from the hip, not the...
Right. This is the opposite.
Right.
Yeah. Okay? The reason why we don't use muscle energy is because it's locked. It's locked on those nooks and crannies I showed you in the SI joint, and muscle energy is not enough to unlock it. You need to bring it down with a little bit of force.
You can't have it part of the hip too well.
Doesn't work. There's no home exercise. So you try it once or twice. I wouldn't keep doing this over and over again. You're going to loosen things up. Okay? Let's give that a try.